When people hear the word hormone, they think of sex. But really, the hormones of our body are chemical messengers, and they reach nearly every cell in the body. They help us to grow. They help to keep our bodies warm. They keep sugar flowing into the cells, like we're seeing here. Pretend like that big box is a living cell in your body. Those little red dots are the glucose that just came from some food that your stomach broke down. Now this glucose needs to get into the cells. Let's say this is a muscle cell. The way this happens is there's a hormone called insulin, and when it's stimulated, it's going to open up the gate of that cell, and so the glucose can flow into the cell, and that's how we stay alive. I mean, that without this process right here, the glucose would just stay in the bloodstream. Now let's say you have insulin resistance or perhaps diabetes. Well, what happens is glucose is going to accumulate outside the cell, but it's not going to be able to enter the cell because there's a problem with insulin. Either there's not enough insulin, and that's a case of type 1 diabetes, or we have a situation where there's an insulin resistance. Something's wrong with that insulin. Often it's because people eat a diet rich in sugars and fats, and so the gate is never opened. Sugar accumulates and it can become toxic. The body does try to release it in the urine, and that's why we do a urine test when we have someone who may have some sort of problem with insulin. Pituitary gland, let's take a look at that. That's in the base of the brain. It produces oxytocin for childbirth. It contracts that uterus, and it also controls lactation, the letdown of milk. Continuing with the pituitary, we have the antidiuretic hormone, ADH, and it's going to cause the distal tubule. You can't really see it in this diagram, but the distal means the farthest part of the tubule before we leave the kidney. It's our last chance to absorb water, so it makes the urine real concentrated. Like if we're walking across the desert, or maybe in the middle of the night when we haven't had a drink of water for so long, our body just makes that urine nice and concentrated. FSH in the woman's ovaries to help stimulate the ova production. And TSH is going to regulate the thyroid, which I'll be talking about shortly. Pituitary also releases somatotropin, sometimes just shortened to GH. It's a growth hormone. In the bloodstream, it's going to promote growth in all the cells of the body, especially when we're young. Now, if we get too much GH in adulthood, we may have pituitary gigantism. If we don't get enough GH, so here's gigantism here. If we don't get enough, we get pituitary dwarfism, right? And often these individuals are normal, and it's just that the cells were not stimulated to grow properly. Overproduction of growth hormone in adulthood can cause something called acromegaly, and you can see off to the right. A lot of athletes and even movie stars are using some GH, and what it does is it enlarges the jaw and the hands, and sometimes the skin goes thick. Cartilage and bone growth is a little bit abnormal, so they have to be really careful with this. They use it because it does promote youthfulness to some extent, but it's also dangerous. I said I'd talk about the thyroid. Here it is, surrounding the trachea. It's going to release calcitonin, which regulates calcium concentration. The thyroid TH hormone also affects overall body growth, so we need it. And if we don't get enough iodide in our diet, which most of us do, most salt is iodized, then we have this goiter. And what's happening is the thyroid's responding. It's growing larger in response to not having enough iodide. So it's trying to compensate for low amounts in the diet. Vitamin D deficiency inhibits the action of calcitonin, and that's why we get this abnormal rickets type of bone growth with a severe bow-leggedness. Now, not all bow-leggedness is due to vitamin D deficiency. So this is one specific case. Inflammation or autoimmunity. Autoimmunity means our bodies, for some reason, have been stimulated to attack our cells. And so some disorders are caused by autoimmune functions. Here's hyperfunctioning. You can see it's enlarged. Hyperthyroidism is when there's too much TH, and we get the rapid heartbeat, high blood pressure, sometimes the bulging eyes, which they're not showing here. These people tend to be very nervous. They don't sleep for very many hours in a row, and it's exhausting. The opposite really is hypo. You see the difference here? Hypo versus hyper. And this is when there's low levels of TH. And these people tend to be overweight. They're sluggish because their metabolism is quite slow. And they sleep a lot. And this can be tested and treated. We have drugs containing things such as thyroxine. And so, but the problem is most patients are within the normal limits. Okay, the normal limits are really quite broad. So you could tend to have hyper or hypothyroidism, but insurance won't pay unless you're way on the extreme ends, which can be unfortunate for lots of people, especially if they're trying to lose weight. Parathyroid, look at the thyroid. You'll see these little parathyroid glands here. You can see on the posterior surface. The PTH is a regulator of calcium levels, and I've talked a little bit about calcitonin already. If you see this diagram, you can see the calcium will end up in the bloodstream when our calcitonin levels are high, and that means it's coming out of our bones, which is not a good thing. They become weakened, and eventually we have kidney stones, and even nerves and muscles are damaged. Hyperparathyroidism is the overproduction of PTH, and that's where we don't want to go. How can we avoid that? Sometimes just having a test done, a blood test, and that'll tell us quite a lot. Adrenal glands, they're perched on top of each kidney, so there's a pair of adrenal glands for the body. The cortex is the outer part, and this is going to produce glucocorticoids. Now, these are used in medicine, but our body produces them as well in a negative feedback loop. So what's happening here is the body's stressed, and when that happens, we use a lot of glucose. And now our blood serum glucose is lowered. Let's see if kind of get here a little bit. And now the cortisol is released by the adrenals because in our muscle tissues, in our liver, we have this substance called glycogen, which I don't see here. Glycogen, excuse me. And so that's going to be broken down into glucose, and cortisol is going to speed the rate of glucose absorption by the muscles. And we get back to normal. I know that sounds kind of complicated, and it's not really. Just think of it as we're stressed, our adrenals release cortisol. Cortisol is going to kind of tell the muscles to back off a little bit on the consumption of sugar until glucose returns to normal. I like that description better. Cortisol also shuts down the inflammatory response and speeds recovery. And so it's good for healing. And many medicines contain cortisone. And it's a good asthma treatment as well. And there's very small amounts of cortisone in many of those inhalers. So it's better to use them than to suffer from damage. Adrenal medulla, let's see the medulla's inside. It's going to release some neurotransmitters such as epinephrine. And this causes that flight or fight response. It increases blood supply to the heart, arteries, lungs, skeletal muscles, gets us ready to escape from danger. Problem is if we have chronic stress and the release of cortisol and epinephrine at the same time, it'll shock our body. And our blood glucose levels get way off. So take a look at this. We perceive a stress. The pituitary gland is engaged. It's going to release ACTH. And now the adrenals are going to pump out cortisol and epinephrine. And the problem is this loop, positive feedback loop, just keeps going and going. But we can use this behavioral modification. We can just see something as not being stressful. Okay, we're driving in heavy traffic. Maybe we can just say, hey, isn't this exciting? Wow, this is an adventure. And you know what? It really works sometimes. You can talk yourself into changing your perception about a stressful event. Maybe your first date with someone. You just go, hey, you know what? I may never see this person again after tonight. I'll be nice. We'll have a good time, but if they don't like me, who cares? All right, so that's behavioral modification. Pineal gland, right here, near the cerebellum. It's going to release melatonin, that sleep hormone, and it does this when light levels are low or very dim. It acts on neurons. It's going to lower our body temperature and prepare us for sleep. It's part of the body's biological clock. We have something called seasonal affective disorder, or SAD syndrome, or winter blues, and that's what this woman here. She's got this light that keeps her from producing melatonin. All right. See, we don't want to produce melatonin during the day because we can have some depression and sleepiness, and then we can't sleep at night. So one of the best things you can do in the winter is expose yourself to sunlight, or open the drapes, or turn on the lights early in the morning, and turn off that melatonin so that it surges at night when you go to sleep. Pancreas has these alpha cells that secrete glucagon. That's the word I was looking for earlier. Glucagon is going to be broken down into glucose. And that's how we manage. See, a lot of people don't realize this. You know, they're drinking sports beverages, and they don't realize that we have this stuff called glycogen in our muscles and in our liver. Anytime our blood sugar drops, our body just breaks glycogen back into glucose. And so we got this natural sports drink going on all the time, unless you just ignore it and take those beverages, and then your body kind of gets lazy. Beta cells secrete insulin hormone, which I've talked about, and that's going to be absorbed by muscles, well, lots of tissue here. And this is how we manage our blood sugar level, and then we avoid those big shifts, which I will talk about shortly. We have diabetes. Now, in reality, okay, it's not like 1 and 2. There's like a gradation. There's many types of diabetes. We just break them down like this for convenience. It's an autoimmune disorder, often due to it's a genetic defect, or sometimes a virus, like certain kinds of invasive viruses will rewrite our DNA. And so we're not producing enough insulin. Now, type 2 is where we gradually, sometimes called adult onset, our insulin production decreases with age. Insulin resistance, this is the one you have control over, okay? Because, and this is the one I showed on the introductory video. We're producing enough insulin, but the fat in the muscle cells or something else is preventing the insulin from unlocking the gate. And you remember the red dots could not get into the cell? Well, that is insulin resistance. And that can happen from high sugar diet and fat in the muscle tissues. So that's something we can avoid. Rebound hyperglycemia, we learned a little bit about this. We have consumption of simple carbohydrates like sugars. And let's look at this one. Here we go. Consumption of too many simple carbs. Then we get this hyperglycemia. The insulin is flowing in our bloodstream, and glucose is being absorbed by tissues, and we are on top of the world. We're excited, nervous, hyperactive. Man, things are great. Now what happens is at some point there's so much insulin that there's the glucose, we're running out of fuel. The glucose in the plasma is dropping, and then we get the crash. And I had a girlfriend in college. She would eat cookies. I'm telling you the truth. She had cookies for lunch, these huge cookies that were like 10 inches across. And man, she was so happy. But 2 hours later or less, she was the grumpiest thing. And no surprise there, huh? Okay, it's not as funny as it sounds, because hypoglycemia can develop into insulin shock. And what's happening is insulin is so good at unlocking the gate and allowing sugar into the cells that pretty soon the plasma glucose concentrations have dropped so low that the brain's the first one, but other parts are starved, and so we have a life-threatening situation. So let's keep the sugar, let's keep that sugar out of our diet whenever we can.